My name is Mike Pishvaian. I'm a GI oncologist at Johns Hopkins University. Pancreatic cancer is a deadly disease, and unfortunately, the number of patients per year who are developing pancreatic cancer, or the incidence, is growing. So it's something that more and more people are being aware of and concerned about. And so the question is there anything that can be done to prevent the development of pancreatic cancer? Unfortunately, the answer is no, not that we know of. There are certain subgroups of patients that are at higher risk for developing pancreatic cancer, and there are certain modifiable risk factors that can be addressed. For example, patients who smoke are at increased risk of developing pancreatic cancer. Patients who drink more than 3 or more drinks a day are at slightly higher risk of developing pancreatic cancer. Patients who have chronic pancreatitis also have a significant risk of developing pancreatic cancer, but that's sometimes out of the control of the patient. And patients who are overweight or obese have a slightly greater risk of developing pancreatic cancer. But there really are no clear-cut prevention strategies, prevention therapies, and unfortunately, not even any screening paradigms for identifying pancreatic cancer, with the exception of the patients who have potentially a genetic underlying inherited mutation that may lead to the development of cancer. And even those are very much in flux. So what I'm talking about there is, for example, patients who have an underlying BRCA1 or BRCA2, or what we also call BRCA1 or BRCA2 gene mutation that they were born with. Those patients are definitely at greater risk of developing pancreatic cancer during the course of their lifetime. And it's been studied that patients who get screening endoscopic ultrasound alternating with MRIs do have a decreased risk of dying from their pancreatic cancers, because these cancers are often found earlier. However, these screening tools are expensive, and with the endoscopic ultrasound are invasive. And so they're not established at all for the general population, let alone for the patients with known BRCA1 or BRCA2 mutations. So what I recommend for patients who have a family history of BRCA or known germline BRCA mutation or BRCA mutation that they were born with is that they get to a center that has an established screening paradigm, or it actually is studying what's the best way to screen patients for the development of pancreatic cancer. The second question is, for a patient who has pancreatic cancer, and unfortunately, we don't cure many of these patients, but for those patients who are cured of their pancreatic cancer, how do we prevent a second pancreatic cancer from developing? This is not how do we prevent the first cancer from coming back and spreading. That's a whole different discussion on post-operative therapy. But really, it's a discussion on the remaining pancreas that's left over. How do we prevent these patients from developing a second primary pancreatic cancer? And unfortunately, I've seen it happen in some of these very high-risk groups. Again, those with potential BRCA mutations or chronic pancreatitis. And we really don't have any way to prevent the development of a new pancreatic cancer. But those patients that are at high risk, have already survived one pancreatic cancer, they definitely should get into a screening program. Again, the best way we know how are alternating endoscopic ultrasounds and MRIs. And because those patients are at so high risk of developing a new cancer, it's well worth it to go through those screening tests.